So this construction project is going to be in 3 phases. Currently, we are almost wrapped up with phase 1. So we have finished our demolition, abatement, and currently, if you were to walk through there, you will see a lot of framing, walls going up for our new patient rooms. While this construction is important to the community and it's important to our patients, it's also important to our staff. It's important to my team. Our nurses are going to be able to have state-of-the-art technology with computers in every single room, which makes their job so much easier. And the space, they need the space to properly care for their patients. We don't have to travel an hour or more to get that care. It's going to be right here in your own backyard. This is so exciting. This is an amazing project. It's awesome for the community. It's awesome for our patients. It's fantastic for our employees, and we just can't wait for it to be done and move into the new space. My name is Cheryl Stillwell. I am the Director of Medical Surgical Services at Oswego Health.